When booking a transfer, we normally have two transfers. Critical transfer, where a patient is being transferred from one unit to another for specialist intervention for a life-threatening condition, something like stroke or primary angioplasty. And there's an immediate transfer where the patient is being transferred for immediate treatment, normally within the hour of arrival. When booking a transfer, we normally like it booked by the senior clinician, or at least somebody who has some clinical knowledge of the patient. Use the correct type of transfer, either a critical transfer or immediate transfer, the terminology when booking. We need to know some details of the patient, what's wrong with them, where they're going, any other special things like that. And please be ready for us. If it's a critical transfer, we'll normally be with you within 15 minutes. If it's an immediate transfer, generally within the hour. If there's any equipment that you need from the ambulance crew, such as oxygen or monitoring equipment, or if you're going to be bringing any specialised equipment yourself, such as an intra-aortic balloon pump, then let us know when you're booking the vehicle, especially if you are bringing a balloon pump, because it will make a difference to the type of vehicle we bring. When the ambulance arrives, we'll normally arrive at an emergency department, mainly because they're open 24 hours a day and we know where they are. If we're bringing down equipment to the vehicle, be prepared to actually carry some down because they're limited to the amount of equipment we can actually put on a stretcher or have hanging from it. When we get to the bottom, to the vehicle itself, if the patient needs to travel in a particular direction, we need to know that from the start, because in most cases trolley beds only fit into ambulances one way, and we're used to travelling with patients travelling with their head first as they're going along the road. Once on the ambulance, you need to be aware that there's a limited amount of room for the people who are travelling with the patient. With equipment, again, you need to make sure that the equipment itself is stowed somewhere nice and safe, so it's not going to get in the way or cause a problem if the vehicle is moving around. Ambulances carry a fair amount of equipment, in most cases 6,000 litres of oxygen, suction units, monitoring equipment and other equipment you might need. If you have any particular questions, then contact the clinical support desk in ambulance control. All critical and immediate transfers will take place using blue lights and sirens. Any specific requirements that will affect the style of driving, you will need to discuss it with the ambulance crew. The ambulance crew will also ask you what sort of journey you want. That's entirely up to yourselves. What you probably want is something whereby we can take some time off the journey, avoid traffic, go across traffic lights, things like that. If they're travelling too fast or it's too uncomfortable, tell the ambulance crew, they'll slow down. If they're travelling too slowly, then again, tell the ambulance crew, they'll pick it up. If there's any problems en route, again, tell the ambulance crew and they'll do what they can, journey-wise, to help out. If you have to do any treatments en route, then again, let the crew know. If you have to stand up, at least that way, if they make any manoeuvres or sudden braking, you're not going to end up falling on the floor or indeed falling on the patient. Finally, can we bring you back? Our policy is no. So you need to know your trust policy on how you return. Should you be wearing outdoor clothing? Do they provide cabs or whatever other policies are there for returning equipment? Remember, we're here to help you get your patient from your unit to the unit you're going to, comfortably, safely and without risk. Talk to your ambulance crew and help them to give you the best journey they can give you and the best experience for your patient.